And health officials say 16 have developed flu-like symptoms, and of those, 3 came in with the flu just 3 days ago, and 5 have since developed the flu since being in the migrant shelter, all coming from Texas.
All of the individuals with flu-like illness, including those who tested positive for flu, all arrived in San Diego from Texas.
On alert after the County of San Diego says our health officials are now responding to an influenza outbreak among asylum seekers recently flown to San Diego from Texas by the Department of Homeland Security.
The federal government should not be dumping its problems on San Diego County.
County Supervisor Diane Jacobs says medical staff at the shelter have identified a flu-like illness in as many as 16 people at the shelter who arrived in the last few days.
I want to stress that we are taking all appropriate steps that we can to contain this outbreak.
She states there has been a heavy strain on local resources since the federal government ended the Safe Release program back in October and stopped paying the bill. So far, the county says it has processed some 14,000 asylum seekers who have received health screenings.
The cost to county government, our general fund so far, is in the neighborhood of $2 million, and that number is growing each day.
With at least 4 planes carrying more than 100 migrants landing in America's finest city from Texas, officials say health concerns are raising.
Now, this is not the first time we have detected flu symptoms in our shelter, but this does represent an increase in frequency driven by those sent to California from the state of Texas.
All local medical workers have received their flu shot, and the state has given $30 million for these health operations.
There were some individuals who did not have symptoms on presentation and developed symptoms while they were in the shelter, so there was a potential exposure to other individuals.
Dr. Dean Seilinger of the county says his team is providing health screenings upon entry and assessing everyone for their clinical needs.
Start to ramp up preventive treatment for everyone entering the shelter so we can ensure they're protected, and as they leave the shelter, they're not spreading the disease to others.
And the county says this strain on resources for health services has been so severe, they're now filing a lawsuit against the federal government.